can say that we also have done some experiments ourselves where we use the drug ketamine and found that dosing animals with ketamine could restore juvenile-like plasticity in the adult visual cortex. So this is conceptually similar to what Ghoul's doing. And, the TTX treatment, the upside is it's very local to the visual system. It's a circumscribed treatment. There are no systemic effects, whereas psychedelics or other treatment are systemic. And so, you just have to, I guess the big thing is that we're sort of plowing fertile ground now. So we think we have learned that using the knowledge of synaptic plasticity can suggest ways to promote adaptive plasticity in the adult brain. And I think there are going to be a lot of different angles of attack on this, but I'm very excited about that we're going to have a breakthrough sometime in the not too distant future on doing this. And I would also say that the concept, the metaplasticity concept, is a very useful way to think about any type of neurotherapeutic approach to, loss of function diseases, whether it's be recovery from a stroke, for example, or other neurodegenerative diseases, is like, can we boost synaptic plasticity in a way to recover function? And so I think it's a very useful concept, a way of thinking about it, framework to think about neurotherapeutics.
Mm-hmm. Yeah, I suppose, to the extent that reopening critical periods, inducing metaplasticity works, in principle, it has, I think kind of what you were getting at there is it has this potential to be an across the board solution to lots of different types of problems in the brain.
Yeah.